A poison is anything that someone swallows or breathes, or that gets into the eyes or on the skin that causes sickness or death. Many products can poison people. Here are general first aid actions to help someone who has been exposed to a poison. First, make sure the scene is safe from the poison. You'll want to take extra time to look for spilled or leaking containers. If the scene seems unsafe, do not approach. Tell everyone to move away. Stay out of the scene if you see multiple people who may have been poisoned. If a person is not responsive and not breathing normally, if their behavior is abnormal, they appear sleepy, have had a seizure, or are vomiting, you'll need to phone your local emergency response number and get the first aid kit and AED. Tell the dispatcher the name of the poison if you know it. The dispatcher may connect you to a poison control center. Give only those antidotes that the poison control center or dispatcher tells you to. The first aid instructions on the poison itself can be helpful, but may be incomplete. Some places have a safety data sheet, or SDS, that provides a description of how a specific chemical or poison can be harmful. It may have first aid recommendations as well. If the person has come in contact with poison, but is still responsive and breathing and acting normally, phone the Poison Control Center. The phone number for the Poison Control Center should be in the first aid kit or prominently displayed in areas where chemicals are used. When you call your local Poison Control Center, they may ask for the following information. What is the name of the poison? Can you describe it if you can't name it? How much poison did the person touch, breathe, or swallow? How old is the person? How much does the person weigh? When did the poisoning happen? How is the person feeling or acting now? After answering these types of questions, the Poison Control Center will advise you on what to do next, including whether the person should be seen by a healthcare provider or you should phone your local emergency response number. If there are fumes or other noxious smells present, move the person from the scene of the poison to a different area. This is especially helpful to avoid inhalation for both you and the injured person. If poison comes in contact with the skin, you can wash or remove the poison from the person's skin and clothing by helping the person to a faucet, safety shower, or eye wash station. Make sure to put on gloves before you help the person to avoid contact with the poison yourself. Remove clothing and jewelry from any part touched by the poison. Use a gloved hand or a piece of cloth to brush off any dry powder or solid substance from the person's skin. Run lots of water over the affected area until advanced medical care arrives. If an eye is affected, ask the person to blink as much as possible while rinsing the eyes. If only one eye is affected, make sure the eye with the poison in it is the lower eye so that you don't rinse the poison into the unaffected eye. If poison is ingested, do not use home remedies because they may make the person's condition worse. You should only take actions given by the local Poison Control Center or an emergency dispatcher. Provide CPR if the person becomes unresponsive and isn't breathing normally or is only gasping. Use a pocket mask or face shield to provide breaths. This is especially important if the poison has contaminated the person's lips or mouth.